Hello, my name is Crystal Johnston, and I am an LPN to BSN nursing student at Indiana State University, and I will be presenting my health education project for community health nursing. The title of this presentation is Human Papillomavirus, HPV, and I will be discussing how HPV affects a certain population at risk, which is all sexually active individuals in the community. The learning objectives for this presentation are that the learner will define human papillomavirus and understand the importance of preventing infection. The learner will identify the population at risk and determine appropriate goals for this population. The learner will identify interventions to prevent human papillomavirus, and the learner will demonstrate understanding of evaluating interventions for their effectiveness. Before I begin the presentation, I have included a short pretest for you to complete. Please pause this video presentation and click the link below. There is also a link to a handout to use when following along. HPV, what is it, and why do we want to prevent it? HPV is a group of viruses and is the most common sexually transmitted infection, or STI. There are over 200 types of HPV, and 40 of those types infect the genitals. HPV is so common that most people who have sex in their lives will have HPV at some point. Most of the time, people don't even know they have HPV because it can be asymptomatic. It can also cause genital warts and several types of cancer. Cervical cancer is the most well-known cancer caused by HPV, but HPV can also cause oral cancer, anal cancer, vulvar cancer, vaginal cancer, and penile cancer. Currently, 34,000 Americans are diagnosed with a cancer caused by HPV. So while the virus itself isn't a big deal and there's no treatment for it, you still do not want to get it due to its cancer-causing abilities. Cervical cancer screening is the only HPV-caused cancer that is currently screened for. It can take 10 to 20 years or more for HPV-infected cells to develop into cancer. The National Cancer Institute continues to research HPV and how it causes cancer, so there may be more cancers caused by HPV that have not been identified as of now. What are the risk factors? The type of HPV determines its cancer-causing strength. Some strains are higher risk than others. So the strain you have is going to determine if it's a risk factor. A person's immune status is a risk factor. People with pre-existing health conditions are more susceptible and do not have the immune system to fight off other disease. Co-infection with other sexually transmitted diseases is a risk factor. Another risk factor is the number of children and a young age of first birth. This applies to females only. And tobacco use is another risk factor. So you can see that some of these risk factors are modifiable and some are not. The first step in the care planning for our population at risk is to assess the risk factors, examine the data, assessing the needs of the community, assessing the resources of the community, specifically the accessibility of healthcare services for community members, and determining the attitudes towards health and healthcare. How open are the community members towards health education and healthy behaviors? And how does culture play into this? Next, we will identify the problem with a diagnosis of increased risk of HPV-caused cancers among sexually active community members related to widespread HPV infection. And we will identify our goals or desired outcome, which is to reduce the incidence of HPV-caused cancer by increasing preventative behaviors within the population at risk. Our evidence-based interventions include vaccination beginning as early as age 9. This is the most cost-effective and successful preventative measure we can take. We also want to provide sex education that is tailored to age and culture because some information may need to be presented in a more sensitive manner to certain audiences. Regular screening is an important intervention to catch any precancerous lesions early in the disease process. And lastly, we want to educate the community and provide community members with resources to prevent HPV. This could look like making vaccines free and easily accessible, providing free condoms, and having educational materials easily accessible in a variety of settings and through various uses of technology. Evaluation is the last step in the care plan, and here we are evaluating for effectiveness. Did we meet our goal, which was to reduce HPV-caused cancers by reducing HPV infections among sexually active individuals? Vaccines protect against 80% of cervical cancer and 90% of genital warts. So we can evaluate how effective vaccines are by looking at the incidence of these two manifestations of HPV and determine if they are declining. Sex education reduces unsafe sexual practices, which reduces the likelihood of transmission, as do condoms and dental dams. This is not a guarantee because HPV can still be transmitted. However, it does help to reduce infection. We can evaluate this by looking at overall infection rates. Screening is effective because it allows for early detection and treatment. We can evaluate this by how soon treatment is started and how effective it is. And finally, we can evaluate how the community responds to education and resources. Hopefully, we will see members of the community empowered to make healthier choices. In conclusion, HPV is a really common virus that can cause several types of cancer. It is the most common STI, and most people will have it at some point in their lives. Preventing HPV infection is the key to successfully preventing HPV-caused cancers. Vaccination is the most effective way to prevent cancer-causing strains of HPV. Sex education and safe sex practices will help reduce transmission. Regular screenings are important to catch and treat infection quickly. Through utilizing these interventions, we should expect to see a decline in HPV-caused cancers.